All right, good afternoon, everyone, and thank you for joining us for today's webinar, which will cover the new OSHA emergency response rule and its impact on EMS. Today's webinar is being presented by Scott Moore of Moore EMS Consulting. For those of you who don't know, Scott is also the American Ambulance Association's Human Resources Consultant and is a great resource for any AAA members who might have questions related to this topic or any other HR-related topics. Scott will also share his contact information as well as the AAA's contact information at the end of today's webinar, and we encourage you guys to reach out if you guys have any questions or need any assistance following today's presentation. Just a quick few housekeeping items before we turn it over to Scott to get started. So today's webinar is being recorded and will be available tomorrow in the AAA store, along with the PowerPoint slides for anyone who's interested in sharing today's presentation with other people at their service. If you have any questions throughout today's presentation, you can use that Q&A feature on your menu. Scott will try to get to those questions throughout today's webinar, but if we don't get to them as you post them, we'll be sure to answer them at the end of today's presentation. And with that, I'll go ahead and turn it over to Scott to get started.
Thanks, Meg. I appreciate you bringing us in and for hosting the webinar today. And I want to thank all of you who have logged in from all over the country. Actually, this is a pretty well attended, over 125 folks on this webinar. I know we had about 190 registered. Not surprising, though, of course, because this is one of the bigger rules to impact EMS and public safety agencies really in the last probably 10 or 15 years. Just one of the things that I will encourage you to do if you haven't already done it so far is our annual conference is coming up this April in Nashville. Make sure if you haven't already done so to register for the conference and come out and see us. There'll be a whole bunch of folks. Great agenda is set up. And for those of you who've gotten the webinar slides throughout this webinar, there will be hyperlinks like there is at the bottom of this slide. Those hyperlinks will be active and will take you to any of the underlying information. So before we get started, of course, the purpose of today is for informational and educational purposes only. I'm not intending to give you legal advice. If you need legal advice, I'm more than happy to connect you with a lawyer that's licensed in your jurisdiction. So just really we've got a lot of ground to cover over the next hour. And so just want to quickly, we're going to talk a little bit about the history of the rules governing EMS, relatively few as it relates to OSHA, the history of the current rule, sort of the stated justification for this rule. I'm going to walk through very high level. This will be one of what will likely be multiple webinars relative to this rule as it works through the comment period and then eventually for whatever its final rule ends up looking like. But we're going to go through a breakdown of what the rule covers, some overview of the rule provisions, and then sort of next steps. So most of you are familiar with OSHA, and of course the fact that the Occupational Safety and Health Administration was created in 1970, and the Occupational Safety and Health Act created the OSHA, and they largely govern employers in the United States, depending upon, we'll talk about based upon states how that is. But really the goal for OSHA is to create a safe work environment for men and women who are working in employers around the country. They've, of course, got numerous standards. Many of you are familiar with 1910. Of course, you're familiar with your duty to provide a safe work environment and to identify any hazards and remove those hazards. And of course, OSHA's overwhelming goal is really to educate and help employers with compliance. And that being said, OSHA has a ton of really great resources on their website that employers can use, stuff like hazard assessments or risk management plans, stuff that you can go on and in many instances use if to modify it to fit your organization. But they do offer a wealth of resources. In full disclosure, I used to work for the United States Department of Labor, not OSHA, worked for the agency that did employee benefits. But I will tell you that the folks at the Department of Labor generally, of course, are doing their best to do what is generally pretty thankless work. So I applaud OSHA's efforts, or at least their intent around the rule. Now, the rule itself leaves a little bit to be desired, and we'll get into what that means as we move along here. So just so we can talk broadly, there are those those states, the ones that are in light blue here, the lightest color on the map, those are federal OSHA states. Those are states that are governed by the Federal OSHA Act. The other states, the ones in darker blues, so the medium blue color, those are states that have an OSHA approved plan, right? So in the federal OSHA states, the only employees that are governed by federal OSHA are private employers, nonprofit, for-profit employers. No governmental or municipal employees are covered in those states by OSHA, in those states that are under the light blue color. So in the medium blue color, those states, of course, are the ones that have a state-approved OSHA plan, and that in those medium blue state colors, the employees that are covered there are not only the federal OSHA employees, so in other words, private, not-for-profit employers, but also any state or municipal employee. So if you work for a fire department in Nevada, you are covered by these federal OSHA regulations, even the proposed ones, at least you will be when they become final, because your state has opted to have an OSHA-approved state plan. Now, in the dark blue states, so Massachusetts, New York, Illinois, that is a state where federal OSHA covers the private, for-profit, not-for-profit employees, but in those dark blue states, they have a state-approved plan that is only specifically for governmental employees. So, sorry, I scrolled the wrong direction. So just to give folks an idea, there'll be no coverage for state employees in these states below, right? So in other words, if this proposed rule will generally, at least directly, not impact any municipal employee in these states. That being said, remember, the measuring stick for a lot of governmental entities are in fact the private entities. And as it relates to if you cross a border and you are in a state that has, if you're in a state that has an OSHA approved state plan, you will be your employees who might move from one state to another are going to have an expectation that the rules, right, are going to be similar, or that the safety provisions. So just if you want to figure out whether or who is covered, just follow the link on the bottom of this slide. So back in just a little history on this rule itself, back in December, OSHA announced that it would be publishing a rule sometime in January of 24. And in fact, I was kind of sure that we might not ever see that rule because they do this a fair amount. Now, what they said was they were going to try and modernize the Fire Brigade Standard that was first published back in 1980. So 44 years ago, they published the Fire Brigade Standard, and that standard has not been updated since then in 44 years. Now, I covered this in the HR update that we did in January, just very, very high level. They hadn't actually published the rule yet. So this rule is going to apply for certain to all private EMS organizations. And just so we're clear, the rule covers both emergency and non-emergency work that those agencies will do. Now, it will cover municipal fire and EMS organizations in any state that has an OSHA approved plan. So that medium or dark blue state. All right. So there will be, though, no coverage in this plan for those states where you were just for municipal employees or governmental employees in the states that were in the light blue. So where they're just covered by federal OSHA. So their feeling was here that they were looking to update these protections because, frankly, what I think happened was COVID occurs and there are a whole bunch of shifts in the workplace and people, not only line of duty deaths, but folks who were exposed to some pretty difficult safety issues. And as a result, I think OSHA felt this overwhelming urge to act. And I will tell you that this right here, these two books are not only the OSHA rule itself, 608 pages, but then also the Small Business Administration's review of the rule and what its impacts will be. Just so we're clear, we have been at the AAA talking with other association groups and other stakeholders and sort of talking with them about trying to coordinate a response to the rule, because there is an opportunity to post a comment through May 6th of this year before that comment period closes. They did leave a 90-day period. But just so we're really clear, one of the things that we're really encouraging the state associations to do, and I know that there are some state associations that the AAA happens to manage as a third-party management service, but then there are others. And what I would strongly suggest are, this is the kind of thing where many comments being posted by different stakeholder groups will be critical. Not only joint comments by the stakeholder groups, but then also some individual comments by those stakeholder groups, because to leave one entity to have to respond and or provide a comment, right? This is a large enough standard that will have such far-reaching impacts, and in fact, potentially really problematic impacts for a lot of agencies. It'll be critical that we really rally everyone. So I want to talk about what the types of covered organizations are. So they have some definitions within the proposed rule that talks about the workplace emergency responder and response employer. This and then they also have something called the workplace emergency response team. So these are the type of employers that are they are not emergency response organizations. So they're not ambulance services or fire departments. They might be an industrial group. They might be, a group that happens to have a subset of employees who either that's not their primary obligation is emergency response, but that may be a function of their role. Or if there's a subset of a team within an organization, let's say, for example, NASCAR or Mercedes-Benz, or one of those organizations that has a large plant that then has an emergency response team, these folks will be covered by this rule as well. So generally, it's employees who provide emergency response as an ancillary duty, but it could also be like, I know, for example, NASCAR has their own emergency response team on the track. Well, those folks will be subject to the rule as well. The other type of covered organization is an emergency service organization, and that is an organization where the primary role of the employees generally are, and the primary role of that employer is to provide emergency service response, whether that be fire or EMS. All right, so, or technical rescue, and we'll talk a little bit more about that as we go along. Now, there's a lot of discussion in that 608 pages about the treatment of volunteers as it relates to this rule. So OSHA is very clear. If you are a volunteer in most federal OSHA states, right? So in any of the states that were in the light blue on that map, volunteers are not considered employees, and as such, they are not subject to OSHA. However, there are states that have OSHA-approved plans that, in fact, include volunteers as employees or as covered folks in their OSHA-approved state plan. So it is important for you all to make sure that you understand, go to that OSHA map, figure out whether your state is an OSHA-approved state plan, and then if, in fact, you are an OSHA-approved state plan, whether volunteers are covered. All right, so that but just in general, volunteers, not employees. Now, there are multiple definitions of volunteers, and I bet you there are some managers on this webinar today that feel like they're volunteering based upon either the number of hours they put in for the money they make. I don't know. What we're talking about is the Department of Labor really defines a volunteer as someone who does not get paid, or really technically, one of their advisory opinions said anybody who doesn't get paid minimum wage. There's a whole host of legal issues around that. But then also the IRS has a definition for volunteer, and it means that a person cannot receive what they call significant remuneration, which is 20% of what you would have paid someone, a paid employee, to do this work. Now, one of the other covered employees in this group is the skilled support worker. Now, these are folks who their primary function has nothing to do with emergency service, but they're often there to support emergency service. And so, as you can see here, I've got a picture of someone who's a tow truck operator, and there are some provisions in the rule that the emergency service organization, when utilizing skilled support workers, there are provisions that protect those workers in their actions or movements around an emergency scene, and ensuring that the incident commander, which we'll talk about further on in the rule, are providing or ensuring to some level the safety of those workers. So this could be in a search and rescue situation where you have a heavy equipment operator who might be exposed to particulates or something like that, where you might want to make sure that person's wearing respiratory protection. So again, one of the reasons why we we sort of waited a little while before we did a webinar on this. We did put out a member advisory pretty quickly afterwards, but we are still working a strategy on the rest of the comment. This is a very broad-reaching rule, and we are mobilizing a lot of folks in the government affairs side on the AAA, as well as some of our AAA members that have larger groups and government affairs folks there as well. So just, again, high-level overview. There's no way in 1 hour we could get through this whole thing. We could spend half a day covering this. And so just want to give you a little background. Part of why they decided that they needed to do this rule was, in their estimation, it was from data used for fatal and non-fatal injuries. As you know, for the last couple of years, OSHA has been requiring the Form 300A summary injury data to be electronically posted or reported to OSHA. And depending upon your size, you had to report the individual injury data as well. There's a great tool on OSHA's website that tells you whether you have to report 300A or whether you have to report 300A, 301, and 300 logs. Certainly, if you need help to get there, and by the way, the reporting deadline, I think, is already passed, but better to do it late than not to do it at all. But if you're not sure, just reach out to us, hello@ambulance.org, and I will let you know whether you have to report your data. But it's, and what we said back then, by the way, when they first passed the rule about injury tracking, was when data's like garbage, if you're going to collect it, you sure as heck better know what people are going to do with it. And what I said at the time was, in my experience at the Department of Labor, was we had software systems that did what was called targeting runs, and it scanned electronically submitted data to look for anomalies or problems. And that is what I'm convinced OSHA is going to be doing as it relates to this injury information. So just recognize that they're going to be collecting more and more data. The individual injury-related data for larger organizations started to have to be collected this year. And so it is important that you recognize that that means more data will provide more information for them and will help them focus their enforcement efforts. So as we move along here, I just want to make sure understand that there are provisions in this. Really, a large piece of this is driven by occupational cancers. Now, of course, a lot of that is really tied to firefighting. And I have a slide coming up where I'm not really going to cover the firefighting side of this. There is probably half of this rule, or maybe even more than half of this rule, has to do with OSHA's provisions related to firefighting. We're not going to tackle that. I'll leave that to the NFPA or the, IFF or IFC. We're going to just stay focused on the EMS-based stuff. So there are some behavioral health, some general mental health, suicide. They said they noticed that that was such a huge issue, especially following the Surgeon General's report that was released just this past year. And then, of course, there's also some provisions in there, exposures to violence. Now, OSHA has not yet released rules relative to violence, workplace violence, but they have been contemplating it. I was up most of the last night coughing, so I'm doing my best to get through without coughing. So their authority to draft standards in this instance is related to their preliminary determination that there's significant risk of injury and or impairment to employees working in this field. So they went out and examined a whole bunch of national consensus standards, not only the NFPA, but ANSI. And along with the rule, they released, I think it was about 25 or 30 questions. That. So they put out about probably 25 or 30 questions saying, we want additional input and we're seeking feedback, right? In other words, they know that some of the rules that they put out there are probably somewhat far reaching, and they're really looking for feedback from stakeholders to respond to that. So they do, in fact, incorporate through reference 22 NFPA standards. So a lot of it related to firefighting, PPE, exposures to combustibles, other health and safety. And then, of course, there were some provisions around adding a type of fire extinguisher to the list of those. We're not going to touch really any of the firefighting stuff. I'll leave that to our firefighting partners to do that. Or we may tackle some of that, but I highly, highly doubt it. It's really not our bailiwick. So these proposed standards really suggest a need for stronger interagency cooperation, right? This past couple years, the AAA, I think, has really done a great job at engaging other stakeholders in emergency response to work as a consensus group as it relates to a lot of our efforts at both the the governmental area, whether it be reimbursement and or regulatory affairs. I think they've done a really amazing job. This rule is going to further motivate a lot of this. So 608 pages, pardon me. I'm going to run through each of these, but just as a quick overview, there's a requirement for a community vulnerability assessment, that you draft a comprehensive risk management plan, that you have. There are medical and not only medical, physical, and psychological or mental health related requirements, training, pre-incident planning, SOPs, and then post-incident analysis. So I'm going to really quickly work through in the remaining 38 minutes or so. I'm going to quickly work through these, just the overview of the highlights, the stuff that I think are going to impact EMS. So this risk management plan requires the development and implementation of a written and comprehensive risk management plan to cover at a minimum. I don't generally read off of slides, but given the volume of information here, I'm going to make sure that I don't miss stuff. So risks that are associated with the employee activities at facilities and emergency incidents, as if that's not broad enough. All right, that they develop, that it relates to training, vehicle operations, both emergency and non-emergency, operations at any emergency incident, non-emergency activities, activities that lead to exposures and other incident-related hazards. That's pretty broad as well. And then reasonably anticipated hazards must be addressed based upon their likelihood of occurrence, the potential consequences, that the employer established priorities for action, and then risk control techniques and post-incident. I will get through the webinar without coughing too much. All right, community vulnerability assessment. What does that mean? I know a lot of fire departments will tend to do, risk management plan looks very familiar to what CAS standards require. Is that correct? There are strong correlations between, if you are a CAS accredited agency, much of this will be easier for you. I'm not going to tell you that there's a complete alignment, but I will tell you, if you're an agency that is CAS accredited, this will be easier. It's going to be one of those webinars. All right, community vulnerability assessment. This is a process of identifying, quantifying, prioritizing potential known vulnerabilities to the overall community that may require emergency services from your emergency service organization. ESO is short for Emergency Service Organization, and that is you if you are an EMS provider, including the community structures, their inhabitants, their infrastructures, organizations, and hazardous conditions. All right, so just so we're clear, this could include things like civil unrest. Believe it or not, that is actually referred to in the standard. Things like workplace violence, but it could also include things such as Superfund sites or particular chemical companies or buildings that might be dangerous. I know my fire department always went out and did inspections and marked buildings that were not safe for entry for firefighting. This would be along those lines. Now, from an EMS perspective, the need is much different. Excuse me. So, all right, very incredibly broad, and in my opinion, somewhat concerning, because this will be that consent working with your other emergency service responsibilities. I mean, other emergency service organizations, but recognize the obligation is on the part of the employer. So while you may depend on your fire department for some of this, you need to, as an employer, be able to identify how you have provided for that. Leading up to the webinar, barely any coughing, but as soon as we start, we get going, probably because I wasn't talking much. So we're going to struggle between the mute button and not. So it also requires that you draft an emergency response plan. That is a response plan that will be drafted, written, and you must involve team members. This will include things such as walk-around inspections. By the way, that includes, as part of that community vulnerability assessment, and what is then another requirement, which is a facility vulnerability assessment. your emergency response plan has to encourage reporting of safety concerns, which most of us have already. That identifies any hazards, injuries, or near misses, and then that this emergency response plan is posted in a conspicuous location. All right, so there are requirements that are both mental health and physical, ensuring that responders are physically and mentally capable of performing their duties without injury to themselves or their fellow responders. All right, so this requires a medical evaluation with surveillance. So this is any significant medical surveillance of team members. So in other words, not only an initial medical evaluation based upon that team member's level of service. So depending upon what you're billing people won't go through the same things that your frontline providers would go through. All right. The purpose of the assessment is to ensure that they can perform those duties without adverse health effects, that they're of the proper fitness to wear the PPE that they're assigned to wear, and that they are evaluated by a physician or an otherwise licensed healthcare provider at no cost to the responder. I think many of us do this now, at least initially. This surveillance will be required to be done at least every 2 years. So when they say medical evaluation, what does that include? It really is not a very lightweight sort of occupational physical. This is a legit physical. Medical and work history, cardiac and respiratory evaluation, musculoskeletal systems, spirometry, assessment for heart disease, blood pressure, cholesterol levels, other heart risk factors, and other tests as deemed appropriate by the physician or licensed healthcare provider, not only initially, but every 2 years thereafter. Also, something that I don't think most of us have now. I'm talking with IAFF, they say that they have this. I don't know what this looks like, but behavioral health evaluations. So this will be a behavioral health and wellness resources at no cost to the employees. These resources can be resources that are available in your community. All right, but there is a requirement that you do a diagnostic assessment, that you offer short-term counseling, that you have crisis intervention resources, referral to behavioral health conditions arising out of the performance of duties, that these resources be available to the employee both on and off duty, and it requires that you inform your team members regularly and on a reoccurring basis and after any potentially traumatic event, not defined. So traumatic event can be a lot of things to a lot of different people. This is going to require a lot of it. Good question. Our EAP covers much of this. Will that do? So you're going to have to do an initial behavioral health assessment and then one every 2 years thereafter. So like you may send someone for a pre-hire physical, you're going to need that assessment for physical is going to have to be done every 2 years. So is the psychological. Now your EAP, yes, can cover this provided it meets the requirements. Now, if you are a AAA member, you are well aware that you have access to Counselor Match program, and Jeff Dill and I will be doing a webinar this time next week, in fact, same day, same time next week, we'll be talking about mental health. We'll probably touch upon this there as well, but yes, Brenda, I think a large portion of your a large portion of these requirements will be covered. But again, recognize this is probably the part of the rule that I think is going to be pretty challenging for a lot of folks. Health and fitness programs. So the requirement in the rules that you implement a health and fitness program that enables responders to develop and maintain a level of physical fitness that allows them to safely perform their assigned functions based upon their type level of duty. Good question. Is there funding for this expanded medical physical assessment or reassessment? No. In fact, what OSHA did do a financial analysis, and what I will tell you is the analysis was pretty significant. But what they also said was that they believed over time, I think the number, and this is a WAG, I think they said about 60 lives would be saved annually from this. Don't quote me on that though. Sounds like I need a physical health assessment right now. Just want to clarify that both mental and health physical screenings will be required for each employer every 2 years. Yes, as of what the rule says right now, yes, it will be required initially and then every 2 years? Or should there be something that arises that suggests that there needs to be another evaluation? So, for example, a fitness for duty or a return to duty. Then, again, these are the proposed rules, very clearly based upon the number of questions that they asked for stakeholder. In other words, they were very clear. We need to know, basically, what do you think of these rules? So I would strongly advise you read those questions. I think I have a hyperlink to them here. You can certainly get them through, just email me at hello@amos.org and we'll get them. Or you can just type in OSHA Emergency Response Standard questions for consideration or something like that, I think, and it'll come up. But so this is the health and safety, health and fitness program. I think OSHA, when they're envisioning ambulance services, I think they are considering, like many firehouses have, a gym in there, and that, the firefighters, when they're not actually responding to calls, have time to work out. A lot of the private services don't necessarily have that. Now, I know some of the private services I know of, they offer, they've worked out a deal with their local fitness club where they can make available, free memberships or reduced cost memberships. My question is employee participation voluntary in the fitness plan? Yes, it is voluntary. However, they have to pass that medical and physical and psychological assessment every 2 years. Has there been any discussion for return to duty or removing an employee based upon physical results? Will there be the ability for the employee to mitigate issues over a certain time frame? Great question, not addressed in the rule. What they said was, they didn't talk about, well, what happens if, 50% of your group comes back is not able to do the job? Nothing is addressed in that. I don't know exactly what we're going to do. There was a fitness for duty piece where, hey, we may require this when someone comes back from an injury or after an incident. But no, it's a good question. And again, keep in mind, a lot of the folks at OSHA, if they did work for private organizations, they certainly didn't work for EMS organizations. So has there been a discussion for return to duty removing? We already talked about that. Will you be talking about the consequences for those employees who refuse or decline to participate? Is the required to offer these things, not to force participation? I'm sure these intersections of HR law related to forcing participation. Also, I have that same cough. That's great. I love it, Jeff. You're the best. Here's what's clear on the rule is that it's the employer is required to offer it. There are a few parts where the rule says you must mandate this, and this comes down to the use of PPE, which we're going to get to in a minute. All right. And so as it relates to the fitness thing, you have to make it available. You have to give them, they even said, have an opportunity for exercise during working hours. I don't know if they've ever been at a private ambulance service, what kind of hours they think they have for this, but I think that's unrealistic. All right. We implemented lifestyle accounts, which allows employee to be reimbursed for up to $300 a year for health and fitness costs. I'm guessing, Cassie, your question there is, would that meet it? I think the answer is yes. I think that would provide them, reimbursed up to, yes, I think that would meet the definition of at no cost. But what I would say is, and I think OSHA's probably they're thinking more proactively, like, you need to cover these costs. How are the results of the exam measured? Who sets the standard fitness for duty? That's part of that. That's part of that risk management plan, identifying what each position is, what the physical requirements are for that job, and I'm guessing in cooperation with, a doctor is going to say based upon your job description. And so, as an HR guy, most people laugh when I say I want to see your job descriptions because they're like, whoever pays attention on job descriptions? And everybody always puts there, and every other duty is resigned. I think the doctors are going to be the one that says, I will tell you that I've seen a lot of people doing the job that I have sometimes wondered how physically they're able to do the job. At 54, I've had 3 knee surgeries, both shoulders and a back. I know for a fact I couldn't do the job tomorrow. Maybe 1 call, but not 2. I don't know whether I would pass a physical assessment by a doctor, even though I can bike for 30 miles. So it's a great question, not answered in the standards. Believe it or not, in 608 pages, they put a lot out there, but that question was not answered. And I think that'll remain to be seen and will be largely determined by the licensed healthcare professional. Does the health and fitness program include all employees in the ESO, for example, includes administration? Great question. Not clearly specified. I think the implication is that it's for those people doing those. What it says is based upon level of activity at the job. So the physical assessment for someone who works at a desk might be something related to back health or whatever, but they do say based upon level at the job. So one of the requirements under the rule are that you designate someone to be in charge of the fitness program. So like your HIPAA privacy officer, your ACA 1557 coordinator, or your infection control person, you now have to have someone who has some training, by the way, around an individual oversee the periodic, oversee the program. Now, there's a requirement in there, and this is the one part of the rule that doesn't quite make sense to me, right? Where they say, hey, periodic fitness assessment. Well, they said they have to have a medical evaluation. I believe their intent with the fitness assessment is an actual fitness assessment based upon the job. And what they refer to in the rule is this can be done through training, right? In other words, lifting a stretcher or stair chairing an employee. So that fitness assessment can be done or at the oversight of this person in charge of the program and can be job related. It's not like you have to run a mile or you have to do a Be Fit challenge. You have to, based upon job requirements, that you have to be able to do physically fit things related to your job. So, all right. Now, I'm going to keep rolling because we still got a lot to cover. Can require training during working hours, right? Can use common emergency response tools in that. Okay, so Meg has kindly let me know that if we run a little bit over, we're good. And I understand we're recording. I know we got a whole host, almost 150 people on here. So I want to make sure we get through it. And I will continue to answer questions. The questions have been awesome, and I'm sorry that I haven't totally been able to answer them. Some of them I can, some of them I can't because OSHA didn't provide the answer yet. And we'll have more information, by the way, after the comment period closes. There's an upside and downside of that. After the comment period closes, they will usually, what they do is they provide a summary of all those comments as it relates to each rule and then provide some further, they either reform the rule or they provide further clarification as to what the heck they meant in the rule. This is important. If you haven't already done so, go on the comment and read the comments that are being put out there. And I'm going to talk a little bit about this at the end, but make sure that you read some of those comments. There's already been a few fire districts who've put in and said, like, and they've had some very thoughtful comments. There have been some others who are like, the sky is falling, doom and gloom. I don't recommend that. To say to an oversight agency that if you make us, like, we can't come out against safety standards. But we'll talk a little bit more about the comment letter that I did draft for the AAA. But what I would say is I strongly encourage against doom and gloom. We can't do this. You're going to close businesses. It's just not an effective argument. So this can be, the fitness assessment can be things like using the member's own body weight, right? They have to do squat, like they have to be able to squat down and lift up. But really, my opinion is it should be tied around the use or the job itself, right? We know plenty of people. I'll tell you, I could deadlift a Model 30 stretcher way back in the day. It's probably why I have the back injury that I do now. But what I'd say is I think making sure that people can physically do the job. And I don't know about you, I've driven past one or two details over the course of my life, law enforcement details, where I'm like, that guy's gonna, or girl, they're gonna chase me? Are they now? I could probably steal and get away with it. So not being mean, what I'm saying is you should have to be able to physically do the job. What that means in the context of these standards is really going to depend. So interestingly, they say that some of the resources that you make available to people can be on the internet or in the community. So there could be like weight management programs that are available in the communities that you serve that you could then say, hey, these are accessible to you. Programs about quantity of sleep and so forth, because we know EMS people are super good at getting sleep. So training. The rule requires that there be, and this is part of that risk management plan, that, and even in your assessment and so forth, your not only your community, but your facility vulnerability assessment, that you have training based upon the hazards that those people, one, that they have training to do their job based upon their certification or role, but number two, that they have training to deal with the hazards that they may encounter. So this comes back to things like workplace violence. We've done a lot of programs here in the AAA about training folks to be more aware and understand their surroundings and how to put themselves in a position where they're less likely to be the victim of workplace violence, right? There is a requirement on this training that it be annually skill checked, that it really is at every level, and that it is based upon the tier of that team. The one thing that they were super, super sticklers about are proper fit and use of PPE. During COVID, I got a lot of beef from people about beards because beards are in, and I get it. I have like a 1 or 2 day shadow here. What I will tell you is, unless you have a PAPR or some other advanced PPE device, it is not possible for you to make a seal with a N95 respirator or filtering face mask. I will tell you, this is OSHA giving you forewarning that if they walk in the door and your folks are not properly trained, and this is the requirement, that you best ensure that they are properly using PPE, and that if you aren't, just so you know, I think the current fine per incident is $16,700. And this past year, or maybe it was January of last year, they went from saying that, hey, if you have 10 PPE violations, we're going to fine you once. Now it's, we're going to fine you each time at $16,000 per violation. I drive down the street like everybody else on this webinar, and I see ambulances go by me where half of the people in the front seat look like Zach Brown. What I will tell you is, you are on notice now that while it is super unpopular, that beards and N95s do not go together. This is not like Reese's peanut butter and chocolate and none. Don't work. All right. So be on notice now. And we all got super lax again because everybody out there again is like Chris Stapleton. So what I'd say is, and if your employees want to use their own, just so you know, under OSHA guidelines, both pre and now, even these proposed regulations, you're obligated to ensure its proper use, its suitability for its purpose, and that it is maintained. If you allow employee to buy their own PAPR, you are now required to maintain that PAPR during its use and ensure that they have it. All right, facility preparedness. This is pretty straightforward. Most of us have this: exits, emergency lighting and exit marking, evacuation plans, that kind of stuff. That's not terribly surprising, but there is a requirement that you a documented facility vulnerability assessment. Now, by the way, I noticed the questions have slowed down. It may be that I've answered them all somehow in genius fashion in like 44 minutes, or I wasn't answering the questions well enough, so you all just stopped asking. Please keep the questions coming, because again, there may be opportunities here within the rule that I can get the answers, and we are keeping track of all the questions. And to the extent that we hit the ones that I didn't directly have an answer to, I am going to then go back to the rule and see if I can find a more detailed, at least guidance of some kind. So the facility vulnerability assessment process of identifying, quantifying, prioritizing potential and known vulnerabilities for the entire facility. By the way, this includes not only the structure, surrounding locations, its inhabitants, its infrastructure, right? That includes things like power, water, sewer, and that anything that could severely impact that facility's operation or adversely impact the health and safety of employees, right? That could also be safety as it relates to intruders, workplace violence, all that stuff. This is their effort. Beth, love Beth. Best question: what about beards and religious accommodations? You have to go through the religious accommodation interactive process with anybody who is asserting a religious, a problem with the PPE standards as it relates to their religious belief. What I will tell you is, the standard now for review for religious accommodations is exactly the same as it is for medical. It used to be lighter. It used to be if it even causes us a de minimis cost. Now the standard is great cost, great difficulty. Here's what I'll say. People with sincerely held religious beliefs sincerely are looking to find a way to respect their religious belief and meet your standard. What I will say is those folks, you may have to accommodate. You may have to buy a PAPR for them if in fact doesn't create an undue hardship, great cost, great difficulty. I can't answer that for you. Some of the more well-funded groups, they're like, no problem. Some of the other ones, they say, we can't do it. You have to be able to articulate that and document that. And I helped 195 people through 195, I think, AAA members through religious accommodations during the COVID vaccination issue. How do you foresee issues of mutual aid agreements in non-state plans where private and municipal agencies will be operating together on the scene? Simply put, if a municipal agency chooses not to abide by these standards, what are the consequences to a private employer? What a great friggin' question. I know I'm totally unorthodox. Great question. You're only obligated to the extent that you have control. So that means that you are obligated to everything that you do have control over. So if you go into an emergency scene, and we're going to talk about this in a minute about vehicle blocking and so forth, your obligations are exactly the same as a municipal agency that's required to do it, right? So you can either ensure proper safety on a roadway or a highway because you've instructed law enforcement to do it, or you've vehicle blocked in a way that makes sense, or and by the way, most of our folks don't always train about vehicle blocking and how appropriate it is, why you always angle the vehicle when you're out on a highway or a roadway, right? Because it changes the perception of where that vehicle is exactly, and it reduces the likelihood that someone runs into the back of the ambulance. Your obligations, these are yours. If your municipal agency doesn't do it, you are obligated to protect your staff, your employees, and if in fact there's an SSW, a skilled worker there that is like a tow truck operator, to the extent that you've instructed them to do something, hey, can you do me a favor and block this vehicle so that we don't get struck with your really heavy tow truck? Great, but you also have to make sure that now that you've instructed that skilled worker to do something, that you're providing some level of protection. Do you see any situation in which OSHA says, we got this wrong? Great, Mike. Great, Dr. Thomas. Great question. I foresee, do I think they're going to say they got it wrong? No. But do I think they're going to say we might have overreached? Yes. So this will come down to, making sure that you're engaging. I know we were talking with senators from North Dakota, yeah, or Montana. In any event, engage at every level. It is not, oh my God, this is awful, you shouldn't have done this. It is, hey, we're going to talk about implementation time periods. We are all moving in this direction, but to do this all in what is a 6 month to 2 year period is going to be impossible. So I think great question, Mike. Do I think they say they get it wrong? Probably not. Do I think they say we may have gone too far? Yes. Or we may extend out. In fact, many of the comments that I saw on the Federal Register, well worth it if you can get on there, which you can, but go on there and look. Are people like, all right, well, can you extend the comment period an additional 90 days? Can you extend the compliance period for an additional 2 years? That sounds more reasonable. So good question, Mike. Facility vulnerability assessment, anything that might adversely affect the health and safety of employees and the critical, as I already said, critical structure. You are required to have a decontamination, not only SOPs. There's a huge contingent of this rule related to SOPs. And Joe, I'll answer that question about when these rules go into effect in just a minute. The answer is we don't know. 90 days from now, May 6th is the closing of the comment period as of right now. My sinking suspicion is they'll extend the comment period. However, 90 days is when the comment period ends. When the rule goes into effect, who knows? We don't know yet. So there is a requirement, huge SOP requirement. And if you're a CAS accredited agency, this is going to be a lighter lift for you. So the 189 or so number of agencies that are out there, this will be an easier lift for you than others. But there's a requirement that you have a decontamination area. or provisions for decontamination and an SOP about storage and PPE that contaminated gear, PPE, cannot be worn into any living space. And in fact, you also, by the way, have to provide to ensure that vehicle exhaust cannot get into the living space of the employer. So this means, question, does this mean we need to have a Plimo vent system? Does it mean we need to have positive ventilation? I've seen state inspectors before trying to tell people they have to put in, excuse me, a Plimo vent system. The problem is what the old standards were is if the square footage of the garage door opening at least equaled 1/3 of the total square footage of the garage space, then the passive ventilation would be enough. Not clear yet exactly what that means. What they say is you have to ensure that those vehicle exhaust does not enter into living space. So what that might mean is fire graded doors between garages, which you should have anyways, and I think probably is building code in most places. But I want to address this real quick. There's building code. I get that. That's not this. This is OSHA, your regulatory agency for employers, telling you, we don't care what building code says. You at least have to meet building code, but here's what we're telling you have to do, possibly in addition to building code. So I just want to be clear about that. Fire suppression. This one's big. If any newly constructed, not building, but any newly constructed sleeping area, living or sleeping area, really sleeping area, has to have interconnected, hardwired smoke detectors with battery backup. Now, most of you probably have that now, but if you have the old battery to stick them up, not going to be good enough. All right. So first of all, interconnected smoke detectors, that's not for any newly constructed area. That will be mandatory 6 months after the rule becomes final. Carbon monoxide detectors, and then for any newly constructed sleeping area, that the building will need to be sprinkled. So I know that talking to a lot of ambulance providers have said, oh, well, we've tried to move into a new building, and the building inspector's telling me that if we have sleeping quarters, we have to have sprinklers. That may be true. This is OSHA telling you, if you have sleeping quarters, it has to have a sprinkler if they're newly constructed. So existing ones don't. But if you go out and open a new station and you're going to have sleeping quarters in it, you're going to have to ensure that that building is sprinkled. So you have to, of course, prevent the exhaust emissions, and then no PPE worn in storage areas. Now, from a firefighter, I will tell you in my years of firefighting, there was this huge swing about turnout gear. Don't want turnout gear in the cabin, we want a clean cabin, and we don't want turnout gear anywhere outside of the turnout gear room or the apparatus floor. That's because a whole bunch of bad stuff comes off. Now, in my days of working on the ambulance, after I got off the ambulance, I'd take off my uniform shirt, kick off my boots, and climb into my bunk. The thought of that now, that we're all a little more cootie conscious, is a little concerning. Do you foresee OSHA DOL agreeing to hold a public hearing? Actually, another great question. There's two from you, Dave. Great job. Yes, they said that we are looking for whether we need to hold a public hearing. And one of the comments that I would strongly suggest everybody consider, at least, is saying we think there needs to be a public hearing. However, recognize what's our position going to be. We need to be cautious. It can't be, we can't be against greater safety standards. What we have to be is for greater common sense safety, achievable safety standards. So more about that. And the AAA is working on a comment rule right now. So there's a requirement that you have vehicle operator training. Now, I know a lot of you have vehicle operator training. Many of you do CVO, et cetera. That will meet this requirement. That is fine. But you have to have vehicle operator training based upon the type of vehicle that that person may operate. All right. That vehicle operator training means you're going to have SOPs related to emergency and non-emergency activities, stoplights, intersections, divided highways, railroad crossings, emergency devices, backing up with spotters. I know for most of you, this is already policies you have in place. If you don't have them, you're going to be required to have them here. All right. Sean, is there PPE storage specific to fire gear, or would it apply to respirators, gloves, traffic vests? It will apply. They did not specify if we're talking about turnout gear, fire gear, SCBAs. They mean all PPE. whether it be masks, vests, anti-high-vis vests, which, by the way, you also have to have a requirement of vehicle training that you have high-vis vests. Great question, Sean. Is there another, Sean? Is there an anticipated date with the ruling go in effect? So, comment period is scheduled to end May 6th. No date on when it would be, go into effect. So we don't really know yet. This is another one. Every single seated position has to have a seatbelt. Now, I know that that's not all that surprising to you because it's required as a rule of thumb. What they're saying is you have to have policies that say that vehicle doesn't move. The driver will not put that vehicle into drive until everybody is seated and seatbelted. And basically, they have to be belted during emergency care. They leave a little wiggle room when feasible, right? They also provide basically, like if you're doing, where sometimes firefighters will ride on an engine with a casket, they say you have to have some provisions around safety related to that. All right. But really, vehicle doesn't move until everyone's seatbelted. Will PPE being stored in the ambulance change? I think PPE being stored in the ambulance won't change. So, potentially contaminated PPE regarding, where it's stored won't change to the extent that you're ensuring that those things are separate and making sure that there's a place for contaminated PPE and proper decontamination processes. And then for non-contaminated PPE, the requirement of where it's stored does not change. What I will tell you, though, interestingly, is I know there's this big clean cab initiative, but I know my years in the fire department, we were always putting our turnout gear. In fact, half the time trying to get our seatbelts off so we could get our tanks on, so we could then get seatbelted again. So that when we came off the engine, we didn't spend 5 minutes getting our gear on with families, hollering at us. So it'll be interesting to see where that goes. Good question, Doug. Brendan, typical federal, we're here to help rule, lots of administrative hoops to jump through. Yeah, and by the way, the majority of this rule is going to drown you, absolutely drown you in paperwork. In terms of things like hazard assessment, do you read this as being very specific, like evaluating types of factory and industry in the community, or more generic, like EMS? No, I believe the hazard assessment means you need to look out in your community, and if you have Dow Chemical in your community, you need to do a hazard assessment by talking with the Dow folks and finding out, if we respond to your place, what kind of risks might we be exposed to? What kind of responses might we be coming to? If you go to a nursing home, we can kind of guess what exposures you might have. If you have a Department of Corrections facility in your area, you are going to need to engage those folks to talk to them about, hey, if we come here, what do we need to know? And this needs to be documented. And by the way, updated annually. So it's a lot. Vehicle preparation. This is for our folks like Doug on here. Shout out to the old days with Doug Cataldo. Vehicle preparedness. They are required for like maintenance, that there are policies around vehicle maintenance. Of course, there's also a requirement, by the way, that if you're an organization that allows your people to use personally owned vehicles, my fire department, you could drive your vehicle to the fire station to pick up a unit, even if the address was next door. He wanted you in a vehicle. If you're in a community where you're responding in your own vehicles, guess what? You have to have a policy around that, and you have to try and essentially have policies related to people's own use of their vehicle during emergency responses. And there will be policies, by the way. This also requires that any piece of equipment, and this is pretty standard in any state, that your equipment is secured so that it is not going to hurt or kill someone in the cabinet, in the patient compartment, or in the vehicle at all. So there must be either behind a cabinet door or in a bracket that is designed for that use. The question I get all the time is, can it be seat belted? They don't comment on that. They sort of talk about a bracket suited for its use. Do I believe if you can, I don't love seat belting anything down. I don't think that that's a really good, effective way of doing that. Seat belts are designed for humans. They are not generally designed for a random piece of equipment. All right. And when I hear, and see people driving around with like their dogs, I go, hey, when your 80, 90-pound dog is floating around the inside of your car, whacking your kids and stuff like that, probably should think about that. And that little cage that you put in the back, by the way, and I have a 90-pound dog, that ain't going to help. How will they do CPR if they have a seatbelt on? Great question. What they said was that little wiggle room is to the extent that it doesn't interfere with patient care. What I will tell you is 99% of the time, EMTs and paramedics can be seatbelted. Just, unless taking people to hospitals changed dramatically since I last did my call in 2020. So, is there an anticipated date? I think I already answered that. So, all right. You have to have policies around roadway and highway incidents, establishing safe work zones. What about first arriving vehicles, coordination with law enforcement, and a safety vest? Now, this is one of those things that your risk management plan and your emergency response plan may defer to one of your municipal partners. Just so we're clear, though, it's your obligation. So you have to make sure that to the extent that their plan changes, that you can show that we went back to our municipal partners. One, we have a policy in place that if they change anything that they tell us. Number two, that we have a policy that we go through this every year to make sure that what we've agreed to as us as an individual ESO governed by these standards, we may be relying on others. And in fact, there is a mutual aid provision in here that if there are services that you can't provide on an emergency incident, that you have mutual aid agreements to one, if you've identified what those are through your community vulnerability assessment or your emergency response plan, that you have provided agreements to address that. Pre-incident planning, this is just what it sounds like, right? If in fact, and we do this a lot in fire so that we know, hey, we pull up to the building, where's the standpipe, where's the Knox box, where's our hookup, where are our hydrants, all that kind of stuff. You're going to need to do pre-incident planning. So this, again, sounds like it's very fire-based, but I don't want to excuse EMS operations from this. So if in fact you know that you're going to go to a college, right, you should have some pre-incident planning to help you get around that college, because I know, or if you're going to the Mall of America, you have to have a pre-incident plan for how do we know what door at the Mall of America to go to? How do we know what entrance for the college? How do we know what entrance for the stadium? It's pre-incident planning in the way that you think. And I know we're over time, but I'm going to continue going because I think this is important. Incident management system. Why they didn't just defer to ICS, I don't know. And in fact, they mention ICS, but say, well, this isn't exactly that. I won't touch it. But what I'll tell you is, functionally, the incident management system is ICS. So they require that you have, or that you use, this incident management system, designating responsibilities of incident command, that there's someone who manages the incident, that there is an individual, can be the incident commander, but somebody's in charge of incident safety, the tactical planning and execution of the incident, that ensures that the incident, the IMS is used at incidents. In other words, that in fact you're using your own incident management plan, establishing command posts, identifying where that is, conducting size up, whether that be an organizational size up or your own EMS-based size up, which I think a lot of us are already doing. It just may not, in fact, I'm confident we're doing it. It just may not be actually documented. Additional resources, like, again, if you need skilled support workers or you need mutual aid, that you identify what those are. Training for team members based upon their tier of duty. And then this is an important one, system for personnel accountability. I know in the fire service, when we get off, we take our accountability tag off, we hand it to the incident commander. That person knows whether we're in the building, out of the building, whether we're at the scene or we're not at the scene. Large scale scenes, and in the years I worked doing incident command, it is easy to it's really hard to keep track of everybody. What I will say is you are going to be required to, and basically IMS is to be used like ICS whenever, basically at almost any scene, depending upon how it's done, that's at the scale that requires it. All right. Incident management communication, right? Mechanism for each member to communicate unsafe conditions to the incident commander. All right. That can be through cell phone, can be through face-to-face, can be through a portable radio. This doesn't mean everybody's got to have a portable. If, of course, you're CAS accredited, each member has to have an independent mechanism for communicating with dispatch. Also, you have to be clear about what your communication mutual aid abilities will be. And then this one's important too. We do this a lot in fire. In fact, we train Mayday all of the time in fire. Why? Because, right, it's high acuity, low occurrence, but you have to get it right. We don't tend to have Mayday procedures for EMTs and paramedics. I think this is something that is, to me, a very smart thing to have. What do we do? I knew one of my coworkers got locked in a closet in the city of Lawrence once for about 30 minutes while her partner initially had no idea, went down to the truck to get something. We should have a Mayday procedure. She had no portable, no way to communicate. Post-incident analysis, and we are almost at the end. Post-incident analysis, has to be done right after any event, that you determine the effectiveness of the response plan, well, the response as a whole, how'd the plan work, do we have any near misses, were any team members hurt or near hurt, and then you're reviewing that response management plan, the incident management system, the post-incident, excuse me, your SOPs, all of that stuff. All right. So basically, after an event, you do what is really a review. Standard operating procedures for incidents involving law enforcement. All right. So you have to have policies. And we've just recently, of course, heard about the sentencing of a paramedic in Colorado. What I would say is, I think this is an area we could all benefit greatly from. We have to have standard operating procedures around our interactions with law enforcement. And it's not just interactions with law enforcement, but any scene where you have an active shooter or some other civil disturbance. So your people need to know, this is predictable at this point. Your people need to know what their role is and what's expected of them on the scene of an active shooter or anything like that. This is another one that kind of ties back to the physical assessment. The physical screenings. This is basically what we call rehab and firefighting, but the ability to do active cooling or warming, depending upon where you are, rest, medical treatment, checking, make sure people are still capable, that they get a break. We do this in firefighting, but oftentimes we don't always think about this in EMS. And if you are at a long-standing event, the EMS, maybe you're covering a fair or you're out at Burning Man, there needs to be provisions for you, you have to make sure that you're doing some level of personnel monitoring. Now, one of the questions that come up is, does this cover non-emergency? They don't discriminate. Now, it is obviously called the emergency response standards, but they do say that you have to have policies and procedures around non-emergency operations as well. So this comes down to, again, community vulnerability assessments, right? And understanding what your folks' exposures are in the relationship to non-emergency work, right? So make sure that again, that's not as clearly delineated there. I could even see rehab section applying to call volume. It's an interesting point, Chris. Christopher, I could even see rehab section applying to call volume and almost mandated downtime. Interesting point. I do think, right, there is a reasonable expectation of how many hours someone can work in a row and how competent. We do know Dr. Patterson out of Pittsburgh has some great research that sort of shows that, hey, right, fatigue's a real thing and it's a problem. So they didn't touch that, but do I think it's possible? I think it's something that we should at least probably include in our risk management plan. I think it's important. Is there a discussion about mandated rest periods? None. But that comes back to risk management, right? Making sure people are physically able to do the job. I think it's implicit. Bill, good to see you on. Is there any mention of exempting some services from some or other rules based upon organizational size? No. There's just not. I would love to tell you there is, but there isn't. Now, I know, Bill, in your case, or your former employer, there are some people, like Tommy Baldwin and I from GMR, we're talking about air medical providers. FAA does exempt, there are specific requirements for the FAA, but what I will tell you is when your folks are in ground ambulances, you're not subject to the FAA. So, all right, this is the question that kept coming up. When is the implementation timeline? So they've identified a timeline once the rule becomes final, but we have no idea when the rule will become final. So we know that the period of comment is May 6th at this stage. I think it's going to probably change, but just to give you an idea of what they're thinking, some things are 6 months, some things are 12 months, some things are 24 months. I won't read through each of them, but look at interconnected hardwired smoke detectors, right? That it's going to take some doing. Now, the question that somebody asked me was, well, what happens if we're using one of those new systems that's Wi-Fi based? I'm going to tell you, I don't think that meets the standard, because if your Wi-Fi goes down, unless it's battery backed up, right? Again, they don't comment on that, but it's important to know. Will the AAA send us a list of talking points and items we should submit during comment period so we can raise a collective voice on it? Sheila, great question. We were just on the professional standards call today at noon, and we were talking about putting together some resources for folks. I did put out a member advisory back in February, I think, and I just updated it to add a little more detail. That's, if you haven't seen that, you certainly can at least get a good sense of what the rule is. It is hard to take 608 pages, put it in a 1-hour webinar or in a 2-page comment letter. We could have had a 30-page comment letter, but what I've learned is if it takes longer to read than it takes someone to go to the bathroom, they're not going to read it. So we got to keep and make sure that you're succinct and get your points done. Take it from a lawyer. No one wants to hear us talk. All right, collaboration. We strongly encourage that you engage various impacted agencies in your network. These can be partners. So if you work with Mercedes-Benz in your area and they have an emergency response team, or GE, our GE here in Lynn, Massachusetts, has their own security EMS force. Those folks are going to be subject to this, not only because they work for GE, but, well, they're subject to OSHA. These rules will apply to them because they're their own emergency response team. So you want to rally the troops on this one. And in particular, right, I think someone brought this up on the professional standards call today, is joint letters from joint groups. So I know in many states, for example, Washington, Oregon, California, Nevada, Utah, Arizona, right, South Carolina, they all are going to cover every single emergency response employer, public or private, right? That is a great opportunity to engage your firefighters association, your fire chiefs association, your ambulance association, your EMS provider association, right? NAEMT, all of those groups should be engaged in this. All right, along those lines, Sean, good to see you too. Along those lines, is there any value to public agencies in federal OSHA states making comments? I do think there is. Here's what I'd say is this is a rising, tide raises all ships. I think it's important that even though they aren't necessarily subject, I think their input matters, right? When public agencies who are not otherwise governed by OSHA decide, they may say, oh, you don't have standing, but they're not going to certainly ignore the comment completely. And if it's consistent with what those states that are governed by OSHA, I think that's important. So Sean, very good question. Comments, I've got the link in here if you want to go look at either what the existing comments that are already there are, or if you want to submit your own comment. What I would say, avoid the we can't do this, this is crazy, you're going to close us, doom and gloom, sky is falling, Chicken Little. Don't do that. All right, but I had never really drafted a comment letter before this letter. I think I've done one before this. What I would say is it took me 5 hours to draft 3 paragraphs. Why? Because I didn't want to include too much and I didn't want to include enough. And I wanted to make sure that I applauded them on their efforts because, by the way, being a Department of Labor employee was tough. No one appreciates what you're doing. They're always happy when you leave. That's just the way it works. So we're going to try and thread that needle. We're going to continue to work on our letter for the AAA. Yes, we will provide you with comments and sort of some talking points so that you can, hopefully put something together in your local area. You're certainly always welcome to reach out to the AAA, hello@ambulance.org. Just put in there, notice OSHA rule or need help or whatever, and I will definitely get back to you. I know we are way over time. And I'm so sorry that I coughed through all this. I didn't COVID test because I was like, Anyways, I don't think I've COVID. I've had it 3 times before. So thank you for sticking with me. Thank you. 25 questions. We had 150 something people on this webinar at the beginning. I know a lot of people usually drop off at the top of the hour. Again, if you haven't already done so, and I just mentioned to Maria today, maybe we should probably do something at annual about this. You probably, I know the schedule is super crazy, so that's gonna be hard, but be sure to register for the conference because we'll probably by then have even more information. All right, so if you haven't done that, and then if you have questions, hello@ambulance.org. My email is there as well. AAA members, of course, you get unlimited access to HR consultant and any of the other consultants that the AAA have, and we'll help you. Certainly everybody else, if you pay to be on the webinar, we're going to answer your questions. And this recording will be available. And as we have more information, we will make sure we get it out. What I would say to you is, though, it is far more powerful when we can draft a letter to lawmakers that say, we represent X number of people. And right now it's like 75% of the ambulance service is providing patient transport, right? Again, well, 75%. What I would say is there's power in numbers. And so please be communicating with your state. And for everyone who's on here, I am grateful to you, but you all know 10 people who didn't attend because they don't care or they think they're too busy. This is one of those things they can't not care about. Make sure you call 2 or 3 people to tell them they need to rally the troops and at least pay attention. So with that, I'm going to say thank you to all of you. I'm going to pass it back to Meg to close us out, and I will look for your questions, and I will also work on the questions that we weren't able to necessarily answer definitively. So Meg, back to you.
Awesome. Thank you so much, Scott. And thank you guys for joining us today. I did write down all the questions that came up on today's presentation, so look for something in the next week or two from the AAA. We'll try to get something out to the membership. Just as a reminder, today's webinar was recorded. I did post a link to the PowerPoint slides in the chat if you want to go ahead and grab those. They will also be available online tomorrow, as will the recording of today's presentation. Again, the contact information for the AAA and for Scott up on your screen. Please don't hesitate to reach out. We're happy to answer any questions you guys might have. And again, if you want to hear more from Scott and other experts in areas like workforce, balanced billing, reimbursement, government affairs, anything along those lines, we encourage you guys to come out to Annual in Nashville this year. It'll be a great time, and hopefully we see some of your guys' faces out in Nashville. With that, we'll go ahead and close it out for today. Thank you again for joining us, and thank you to Scott Moore.
Thank you.